So we supported about 104 countries with HIV funding during grant cycle 7, but 69 of these were prioritized for triple elimination. And we've included interventions and policies that are supportive of community initiatives and really using the integrated approach because siloed interventions are not going to work, so really looking at integrated approaches. And if you look at our guidance for grant cycle 8, it emphasizes integrated systems. It's front and center. It emphasizes community engagement. So we're using that framing to make sure that we do more for triple elimination. And with the current funding that we have, we've seen increased procurement for geotesting, which is remarkable. A good number of countries have come together using our pooled procurement mechanism to be able to harness lower costs for geotesting. And so that's something that we're really proud of. In grant cycle 8 guidance, you will see that triple elimination is a program essential, as well as screening for STIs in pregnant and breastfeeding women as a program essential. So again, guidance is really clear, and I think it emphasizes the importance of triple elimination. I know we're out of time, but again, to say that it's not possible for us to hand over to governments and say governments take these programs on when there is increasing incidence of syphilis and hepatitis B. We have to be able to hand over programs that are in a decline and can be sustainably maintained going forward.
My remarks, Dr. Izukanji, and the power of integration and the very strong leadership that the Global Fund is taking, including through your leadership, on putting integration front and center, and really looking forward to partnering with governments and communities to practically support the enablement of integration. So I know there's more to come on DC8. We're starting next year with applications, but it's very clear, this message here, that there's a strong funding and opportunity and prioritization of triple elimination as part of integration. And so we strongly encourage all of you in the room who are involved in Global Fund and CCMs as advocates to support application for triple elimination where there's a need for that. Thank you. So now I'd like to turn to Ministry of Health representative, to Dr. Stephen Addo. Ghana has a deeply impressive track record of strategic domestic financing for health, inclusive of HIV, as part of your national health insurance system and also as part of your emergency fund, the Mahama Fund, and much more. So tell us more about the progress that is made in financing EMTCT for HIV, as well as syphilis and hepatitis B, and what more needs to be done to ensure that across the board, all 3 diseases are financed through the government so that individuals, pregnant women and their newborns can access those services without financial burden.
There has been a process to try and get government to take care of elimination of social transmission. That's catering for the need of the program. And we have started a process of integrating EMTCT within maternal, neonatal, child, and adolescent health services. So if you take from beginning implementation to data collection, we have had integrated tools, and we are leveraging resources from MNC, Family Health Vision, to cover some of it, because it was not only the Global Fund, sometimes Global Fund funds some of those processes, but once the Family Health Vision also was taken care and everything was integrated, the opportunity was there for things to progress, and actually made a lot of progress. So with respect to the human resource, capacity building, that integration with the family health program made it possible for us to take advantage of other resources aside the Global Fund to take care of the needs. Now, going forward, through the Resilient Sustainable Assistance for Health model of the Global Fund, which more or less was trying to prepare us for greater domestic financing, that model makes it possible for the health system to be strengthened for the 3 programs, including HIV. And it takes care of the broad issues of human resource, the logistics, management information system, the data issues. And through that, we have launched the e-learning opportunity for capacity building and all that. And that, once it's been established, will be taken care of by government, even when global fund resources, not coming. We are all aware of the cuts in funding. And so hopefully, with national health insurance, you are able to access services wherever you are. And then when it comes to commodities, government is co-financing, government is paying for. In fact, some of the years, it's government that pays for test kits. All right, so that is part of budget, and therefore we need to make available to government the needs of the country, and that is factored in budget, and then it is provided for as part of our co-financing obligation. Now, currently and going forward, as we've all heard, there's been the uncapping of the national health insurance. And uncapping means that there's a removal of the limits of the amount of money available, and therefore more money is supposed to be available to cater for the needs of all of these. Now, it's not going to be only for HIV. They're looking at all other GAVI, EPI, everything everybody's interested, but we need to continue to push the advocates to make sure that HIV needs of elimination of antisocial transmission is not left out. By all means, there will be a competition, but we must continue the engagement with government with the data, because the progress we've made is a good example to motivate everybody. Even our coverage is beyond 95% now. But I think we need to be able to project that strongly to say that if we continue to chip in more, the government prioritizes the needs of the children, the mother-baby pair, within the context of maternal child adolescent health, which is one of the major priorities of every government. I think we'll be able to achieve regulation.
And that transition and learning from the investment of the Global Fund and then the government progressively picking it up is exactly what we want to see. So thank you for that. I'd like to turn now to another powerhouse in terms of domestic financing, to Nigeria. So I'd like to turn to you, Dr. Mojisola. So in light of the evolving financing in global health, and at the same time, Nigeria's very strong leadership and response in ensuring that there is the financing in place for healthcare in Nigeria. Tell us more about what's happening with financing specifically for EMTCT, for HIV, syphilis, and hepatitis B, and how that's fitting within the overall reforms for primary healthcare. Thank you.
Commodities coming in. And by the way, we already adopted dual syphilis HIV kits in country, and so of course once the HIV is affected, the syphilis is also affected. Remember, we're leveraging the HIV systems, so it affected us quite a bit. But when to pick up, eventually there was a bit of it affected our performance. So sometimes last year when we were doing almost 70%, we saw for the first half of the year dropped to about 53% testing across, particularly HIV, syphilis, whereas hepatitis is just peaking. And our opportunities also share that for the first time in the country, we were able to procure and distribute over 2,000 HIV testing for our pregnant women. It's also from the Global Fund, and so the push for integration, I think, is one of the strategies that we're pushing in the country, and not just integration, involving also the subnational government. The national government has signed a pact with the subnational, where not just the national government bears the burden of health in Nigeria is on the concurrent list, where the state government also have their own responsibility. So whilst the federal government is coming in with some resources, the state is also asked to also contribute or make their own impact. And we've seen across the states, quite a lot of them have made commitment, particularly to triple elimination, because when we started with the triple elimination, it was, we knew we had to leverage on domestic financing. And so from inception, we were already engaging the leadership at the subnationals, additional national for the commitments, and we begin to receive that. But from the national space, particularly with the PHCs, you're aware of what the current minister, the efforts of the current minister, and it's not targeted at any specific disease. right? So we're saying integrate and health systems strengthening, engaging healthcare worker, building their capacity to provide integrated services, unlike the previous silent programming that we had in country. That's one of the strategies. Also procuring commodities. We're trying to establish system for pooled procurement. And so across all all the blocks, engaging the community, establishing, we had a system of community engagement before, community healthcare workers, which we're trying to revamp as a country right now, because from the just in 30 seconds, sorry about that, from the start of the PMTCC, we're no longer sitting in the health facility, we're going beyond. It's looking saying that Nigerians are over 30% of our women do not come to the health facility. So the whole system is what we're looking at right now, and the language is health systems training and integration, and that's the direction of the country.
We need flexible funding for community-led responses to be able to support our governments to deliver services to their people. So basically that's what we've had, and to make sure that we are within time, I would like to say on behalf of the Safe Start project team, that is a partnership, would like to say thank you to United for the support, for believing in communities, and for supporting this partnership. To PATH, for partnering with communities. And it is a call to action to all of you here who are implementing programs that believe work with communities. That's the only way we are going to eliminate diseases. That's the only way we are going to end AIDS by 2030. But also to ICASA leadership for giving us this platform today to give visibility to ending triple elimination, particularly for children who cannot speak for themselves. So we are here to speak for the children. And to our governments and ministries of health, we appreciate you, and we are really happy that you're taking on this role seriously and engaging with us. To WHO, thank you. To Global Fund, thank you for believing in communities, and as we get into integration, and as we get to reduce resources for communities, we hope that you are going to stand up again and show that it is important to have communities with you, but also that they need to be funded to be able to do the work that we need to do and we need to end. And to all communities, wherever you are and the work that you do, it is well appreciated. And I think one key word for me that has stood out is that we must make sure that we are integrating, but we are also looking at family-centered approaches to ending the epidemic. And therefore, that is one of the calls to action to all of us.